So I would like to start by welcoming everyone. And before we start with the presentation, I would like to present the collaboration behind this assignment. So this digital assignment report has been put together and carried out through a collaboration between Norwegian Red Cross, which were presented here by Maria Rushfeld, and Rambøll, which also now is our newest gold partner. I should be also able to say that, which is, I think that's now official. And representing Rambøll here, we have Ingvild Wang. Maria already mentioned. And of course, us at EBV Norway. So before giving again the word to Maria and Ingvild, I would just to remind you that this presentation will be held up to 1600, and we will have a short Q&A session after that. Then I will just give the word to you.
Thank you very much, Nima. So I'll start with giving a little introduction to our Sustainable Response Project. So within the Norwegian Red Cross, we took action to make our emergency response more sustainable by establishing a 2-year project with a specific focus on environmental sustainability. So this project has several focus areas. One of them is the emergency hospital. So then for the emergency hospital, we have been doing a couple of things. So we have been working on establishing a carbon baseline, looking into the emissions of each product of the hospital. And also in May 2022, so last year, we had a workshop together with Engineers Without Borders. And during this workshop, we came up with a lot of different ideas, which later has been turned into 2 different projects. So one of these projects is a project we're doing together with Rambøll. This one we'll present today, where they have supported us through this process of verifying our calculations from our carbon emissions baseline, and also creating a tool that we can now use after each deployment to measure the carbon emissions of said deployment. The other project is one we're receiving support from Multiconsult through Engineers Without Borders, and that is to do an energy mapping of the emergency hospital. And last but not least, we're also working on getting an ISO 14001, so environmental management system certification of the emergency hospital. And now we would want to proceed with showing you a little video. Let's see.
And Red Crescent Societies. The Norwegian Red Cross supports emergency operations upon request from the International Committee of the Red Cross, ICRC, and the International Federation of Red Cross and Red Crescent Societies, IFRC. Above all, we specialize in health emergencies, primarily through the deployment of our emergency hospital and its associated tools. When a disaster strikes, the situation on the ground must be assessed, and if an emergency hospital is required, we first need to determine the most suitable location for it to be set up. Preparedness means being able to respond with the right people and equipment in a timely manner, and so we always have personnel and modularized kits ready to be deployed. In fact, all of our equipment and medicines are maintained under the ICRC supply chain and strategically pre-positioned at our logistics hub. Once all materials are on site, the emergency hospital can be up and running in just 72 hours. When fully operational, it's entirely self-sufficient, complete with around 100 international and locally hired staff, room for up to 60 beds, and all of the key services you'd expect. From triage and assessment to surgery and life support, through to maternal care, medical care, referrals, and an outpatient department. And the emergency hospital is modular, so it can be adapted depending on the situation. For example, more beds can be added, more surgical capacity, or isolation wards if required. And specialist configurations can be deployed for particular health emergencies like a disease outbreak. If health infrastructure is already in place, we can send personnel to rehabilitate the existing facility and boost its capacity. For every deployment, the Norwegian Red Cross uses its Emergency Hospital Handbook, containing its standard operational procedures, to ensure delivery of a standardized high-quality service. Additional support mechanisms can also be provided where appropriate. We can supply cash and vouchers strategically to communities to help them access the healthcare they need. If the local water supply is damaged or destroyed, the necessary expertise, personnel and materials can be provided through our Water Supply Rehabilitation Emergency Response Unit to help re-establish the supply. We can set up a community-based surveillance system in the local area where Red Cross, Red Crescent volunteers are trained to report health risks and unusual events to the local health authorities. In addition, we have a pool of over 250 trained delegates and 13 full-time standby members with a variety of skill sets who are ready to be deployed at short notice to any location where they can best support ongoing action. And across all of our operations, we are committed to reducing our environmental footprint. The emergency hospital is for short-term deployment. It's designed to be self-sufficient for up to 4 months, although can operate for much longer periods of time. A suitable exit strategy is put in place from day one, whether that's a planned handover to the local health authorities or demobilization should the hospital no longer be required. Through the Norwegian Red Cross Emergency Hospital, we can provide a fast and effective integrated response to support short-term health emergencies and lay the groundwork for recovery and capacity building in vulnerable areas susceptible to disasters and protracted crises.
I always like to share this video as it sums up very nicely everything about the emergency hospital. But let's now go back to the presentation.
Yeah. Okay, I'll take over from here. Now we have some more background info on what the hospitals actually do and what kind of services they provide. And now I'll take you through the method of actually estimating the carbon footprint. So first of all, I just have to have a bit of a disclaimer. We have done a high-level assessment, carbon footprint assessment, and not full LCA, life cycle assessment. And what that means is that we have followed the general principles in the ISO standard, but because of requirements for data levels and transparency, we have not been able to complete all the requirements from the ISO standard. Okay, so the different hospitals, as you saw in the movie, has a bit of different services and modules. And together they can consist of more than 2,000 different products and items. So starting off, we divided these item lists down to each module and divided up the different products for each logistic module. And together with inputs from the user, this led to a total amount of materials or the inventory. Then we broke down each product or item down to the raw materials they consist of. So that might be bandages, gloves, tubes, which we then classified as either polyester, cotton, wood, and different raw materials. Also, from the user, we have transport distances and different consumptions of, for example, fuel, water, and also waste consumption. So then we would multiply the materials with the emission factors. An emission factor is a number for how much CO2 or carbon emissions you produce from, for example, 1 ton of plastic. So then we would apply the right emission factor to the raw material. Then we would have the carbon footprint of each module, and also for the transport, the drugs, and the consumption on sites. This is the method that is behind the tool. The user is only allowed to put in some inputs, but in the background, these calculations will be in place. So if you take the next slide, we will put this into some LCA terminology in case there are some other LCA engineers out there. Our system boundary would be the hospital and all the items and the input that I just listed. And then we would have the functional unit, which would be deployment and operation of one emergency field hospital for the necessary amount of time. And what necessary would mean would depend on what kind of requirements the place or in place, how long the hospital would need to work, but usually it's about 6 months. Yeah. As I said in the disclaimer, this is a high-level assessment, and that means that something has been excluded from the assessment. Ideally, we would have emission factors for each product. Every vaccine would have its own environmental product declaration, so that we would have the exact life cycle emission of one product. However, there are very little healthcare environmental information from the products today, and that's why we have broken down all the items down into raw materials. But in LCA terms, that means that we have only included A1 to A3 and not the processing from the raw materials into the products. Missing environmental product info is also the reason for excluding some specific products, because we're not sure what the product actually consists of and or how much they weigh and other technical specifics. Further, we have excluded food from our assessment, and that is because all the things that the user needs to put in are numbers they need to report to the Red Cross anyhow, so that's numbers they already have. And we have focused on making the tool as user-friendly and easy as possible in order to it's being used later on. Then we have also excluded most of end of life, meaning C1 and to C4 in LCA terms. We do have some waste handling from the waste that has been gathered in waste bin in the field hospitals, but the mass balance between raw materials putting in to the assessment and the waste that we are taking out is not balanced, and therefore it's not accurate. And then last, we have also excluded electricity consumption from the logistics sites. That was the large warehouses that we saw in the film earlier. Yeah, so this is the method behind. And now Maria will take us through the inventory and also through the tool, how it's used. And I think, Maria, maybe it's okay if they ask questions now, right?
Yeah,
Please.
please.
I think so.
Please ask questions, and I'll just share the Excel files. So first, we'll have a look at the inventory, so the background document, where all the data is put in. So first, you just have a introduction page. Then we have the summary. So the summary, these are these values that are then put into the tool. We have also made a quality score and a completeness score. The quality score is a bit low for now because we're missing some of the sources of the emission factors, but these are things that we will work on later. So the completeness score, that comes from we're not able to find emission factors for all the products for this time, so it's been done for 80% of the products. So that's what that means. So this is also something we can work on improving.
So I just want to say that the quality score, it means whether or not we have the accurate emission data for that product, right? Yeah. So in the future, when we hope that healthcare products also have more factual information, the environmental product declarations, we will be able to update and increase that score. Yeah,
exactly. So here I'll just go through some of the modules that we have set up.
So these are the item lists that I mentioned.
Item lists,
Yeah.
exactly. And which kind of category they have. If you're able to identify the emission factor, its unit, quantity, weight, the emission, and then we have evaluated the quality and then potentially a comment in the end.
So it was quite a big job going through all the materials.
Huge. So here, fine. Yeah, sorry.
No, I was just saying, or that the reason for why we have done that is so that the user does not have to, right? So the user could just say yes or no on whether the logistic module is included, and then the emissions are already calculated.
Exactly. So the final tool should be very easy to use. And so here we can see that some of the sources are missing for now. So this is something we'll work on. And at least the last one is the emission factors that we have excluded. So hopefully we'll be able to put several of these over into the other categories. So this was the background document.
Any questions to the background document? First time I saw the list, I was very overwhelmed because I'm not that into healthcare products, but now I know
There is
what they
one.
are. Yeah.
Sorry, there is one question in the chat, since you want to take that as going forward. The question said, where did you get the emission factors?
So there are different databases where they have emission factors. So we have, for example, used base carbon ADIM, and we have used DEFRA, and EcoInvent is another, IDEMAT. I also would like to see if we can find, because sometimes some of our products are specific to the health sector. So if you can find the one that is the most precise, and yeah, that's good.
That was a good question. That was, yeah, one of our first questions going into the project as well.
Yeah, definitely.
So what are you showing now?
Now I'm showing the tool itself. So I was thinking maybe we could try to do a little test, see how it works. So I'll start just filling in some numbers. Let's say the hospital is a 20-bed hospital, and we're sending out maybe 40 delegates. For the distance from the storage where it's stored to the disaster area is maybe 3,500 kilometers. The weight of the hospital might be around 50 tons. Let's say for now that the delegates are traveling the same distance. While we're in field, we use diesel for the generator. This could, for example, be 6,000 liters. We also have water consumption. This could be maybe 700,000 liters. And the waste generated could be, for example, 1,000 bags. And for this example, maybe we want to send out the maternity module and the surgical module. And then we would also like to add the drugs that are included in the hospital module. So these pink ones are the only fields that the user can change. So they add in the key information there, and then going down, we see that here the tool itself, it's calculating what modules and how many of the modules. And then we get our result. So for this deployment, the total emission was 734 tons of CO2 equivalents.
That was easy.
Very good. Any questions to the tool?
Yes, there's one question. There was another question about, I think that was regarding the emission factor, and was that how did you evaluate the quality? I think it was a extra question to the previous question first.
Yeah. We have been through a collaborating projects with other actors in the humanitarian sector, and there we have landed on some emission factors that we have agreed on. And there's a whole project going on there, and through that projects, some of the quality of those emission factors were evaluated. So those are good, and they're all in we'll use the same one for this tool as well. However, there are some other emissions factors that we started to use before we got access to these common emission factors that were agreed upon. So now we need to look into those, and because these don't have necessarily oral sources yet. So these will need to be evaluated, and if a good source cannot be found, we have to see if maybe we want to use these other ones that have been there has been established an agreement on instead. So this will be a phase 2.
Thank you. So there's a question to the tool.
Yeah.
Is a automatic update of the information used in the tool in the case the information in the source document is updated?
No, there's not, but that's possible. It's quite easy to make them fit together, but what is important is that if we have one background tool, which are changed, then that has to go into all the tools, Excel sheets, right? So then you need to have it linked to the right background document. So this is not a very advanced tool. It's only Excel based. So I mean, it's possible, but then you need to make sure that everyone's using the same Excel sheet.
Thank you. Continue.
I just want to say one more thing about the background. No, about the sources and the quality of our emission factors, because one of the main principles of LCAs and environmental assessments is that we need to have a high degree of transparency, and we want to be able to tell the source and emission factor of all the products that we have used. So that will be very important going forward. Yeah, and that's also why we have established the background documents.
Very good. I'll then continue with the presentation, and we can take more questions in the end. So we also thought of trying out a case with the tool. So our case this time is Al-Hol. So first I'll just give some background information about this specific case. So access to health services is crucial for these 50 to 60,000 people stranded in the Al-Hol camp northeast in Syria. It was on the last day of May in 2019 that we opened a tented emergency hospital in the camp, together with ICRC and SARC. So 55 tons of medical equipment and tents were sent down, as well as staff. Before the hospital was set up, the people in the camp had very limited access to healthcare. So this emergency hospital, which contains an operating room, intensive care unit, and a pharmacy, provides life-saving surgical and medical assistance.
Okay, so that was the reality, right? The field hospital itself. And then on the right, we see how that translates into the carbon footprint assessment. So the user needs to put in the different factors that Maria went through earlier when she showed the tool. And also that we have them in different modules. So these numbers and this case gives us the results on the next slide. Yes. So first of all, the total sum, or the total carbon footprint, was calculated to be about 1,300 tons of CO2 equivalents. And CO2 equivalents means that it's the sum of all greenhouse gases. So in addition to carbon dioxide, it's also methane and nitrous dioxide, which then is equal to the global warming potential of the greenhouse gases. And to set the context, this total is equal to about 200 people flying round trip Oslo to New York, or about 3% of the emissions from materials in our new National Museum. And from the figure on the right, we can see that the production of the medical equipment and the drugs, they have a substantial footprint. And to be able to reduce those are very important in order to reduce the carbon footprint of the field hospitals. I think it's very interesting to see the amount of emission from medical equipment and also the transport needed in comparison to the fuel use, which we know that fuel or fossil fuels has a lot of carbon emissions. Another thing we can see, because the yellow part of the cake is so large, is that having the medical equipment stored close to where we think we could need a field hospital is a good measure to reduce mitigation. Yeah, so that was the result for this specific case. We can see also on the left that emissions from single disease module is 0, and that's not because the module emission is 0, but it's because that has not been deployed. So depending on which field emission you are, field hospital you are calculating emissions for, you would get different emissions for the different modules. And just to say that we know, and we really think the most important thing is to cover all the necessary services that the field hospital should have. But it's also important to know the carbon footprint in order to look into what kind of mitigation measures can be implemented without reducing the efficiency of the hospital. Okay, should we go to the next page then?
Yes, so this last slide is then on further work, what we can do to improve. So for example, now that we just looked at the results from this concrete deployment, one thing that we can do is to try, as Ingvild mentioned, to move the warehouse closer to where you would think, or more central location. So we're planning to, or in the process of moving the warehouse from Oslo to Nairobi in Kenya. So this is ongoing. We also have a green procurement project together with ICRC, which is the International Red Crescent organization. And yes, and we would like to use this tool now as part of our deployment evaluation. So after each deployment, we have an evaluation, and now we want to include this tool into that evaluation so that we can, as a way of looking into this carbon emissions, but also getting a focus then on the environmental aspects.
And for the tool itself, we would like to test it for different in different evaluations, and then hopefully improve it based on the feedback from the users. Maybe we could link it up with the background document, which was suggested here. And we would also very much like to reduce the uncertainty to increase the quality score and the completion score that we saw in the background documents. And then I think maybe that's the last point, then to include more products. Yeah, and that would also hopefully be possible through asking for or pushing for green procurement and asking the health sector to provide more detailed information on their products and processes.
Yes, thank you very much. I think that's what we had for this time. Feel free to ask questions.
Thank you to both. So we have some questions in the chat. You're allowed to ask them out yourself, or I can read them. Anyone who wants to step up? No, then I will read the question. So okay, there we go. So there's a question. When you do a joint deployment, how do you calculate the carbon footprint?
So what's been said about carbon footprint calculations for now is that it kind of follows, it's supposed to follow the money. So what you have paid for, that's your emissions. So if you have a joint emission, then you would have the ownership to the emissions that you kind of link to your financial contributions.
Thank you. The other question here is, how realistic do you think it is to reuse medical equipment to reduce emission?
Sorry, could you repeat that?
How realistic do you think it is to reuse medical equipment to reduce emission?
So how it is for now, it's mostly handover. So the Norwegian Red Cross would set up an emergency hospital for 6 months, and then if the need is still there afterwards, someone else would most likely take over, and then take over the tents and continue using all of the equipment. And then finally, if the hospital will be closed or it's changing in some way, equipment could also be handed over to either local hospitals or the local Red Cross or Red Crescent Society.
Can I ask a follow-up question on that?
Sure, Anders.
I was just wondering, have you done this, used your tool on several locations to see if you see any clear trends? For example, is medical equipment really the biggest factor in any simulation you've done? Have you seen any trends like this?
So we just the tool is just it's new. So yeah, we just tried out with a case. But we're also seeing from other, so we're also doing the emission calculations for the whole organization, and we see that procurement is typically, so this scope 3 procurement, goods and services, is typically a very big contributor.
Okay.
But also, I just have to say that when we saw what kind of exclusions we had done for the system boundary, right? We had excluded food and also some of the operation emissions, so that what we have focused on including is the healthcare product. So that might lead to them taking a bigger share of the emissions. But with that said, we know that we are underestimating those emissions because we only have the raw material production and not the processing of raw materials into the products. So to sum up, we are underestimating the healthcare products, but we are also excluding some of the other at least.
Okay, so there's no EPDs for such products yet?
We have looked into it and didn't really find any.
Okay.
Yeah, but I think that makes sense because they haven't really needed to compete on environmental score yet. So they haven't had the need to make EPDs.
Okay, thank you very much.
Thank you. And Lahti, you have raised your hand, so please.
Thank you. My name is Ritva. Unfortunately, our teams always turns the names round. So,
Sorry about that.
I'm from Finnish Red Cross, and I would like to thank you for the presentation and congratulate for all this hard work you've done. It's really impressive. But it was my question about the joint deployment, because we often do joint deployments with the Norwegian Red Cross when we send out the hospital, and it's a huge effort where both partners, or even if we have several partners, everybody brings in their own baggage. And I understand for the point of calculation, you do have to sort of narrow it down in terms of you pay for the emissions, or you calculate the emissions that you pay for. But in order to be complete, for example, this Al-Hol example, where we were present as well, so you would be missing our part of the emissions. So it may be something that you might want to point out in the future presentations. So it's not the entire hospital, it's your share of it or your part of it. Of course, it doesn't always apply because you may have a deployment where it's just you. But keeping that in mind, it would be good if we can somehow work together so that we are also part of this this carbon calculation tool with the ICRC to see if there's a way that we can do a joint calculation or somehow estimate the entire footprint of a hospital. And of course, there are always limitations because you just don't have the perfect information. But I would invite you to do that with us. Thank you.
Oh, thank you very much. That would be very interesting to look at these things together. Definitely.
Thank you. And then a question from Jonas. please.
Yes, hello. Thank you for an interesting presentation. I like the results was interesting to see how the products are a big factor. So I'm working with the energy mapping that Maria mentioned earlier, and what came to my mind was how sensitive are the results for the energy use. There's all these different places you can deploy, right? So it would be interesting to see how that could play out. How big is the difference between different deployments and sizes and this stuff? Because we see that there's a little bit of different fuel consumptions based on many things. Do you have any comments? Do you have any thoughts about it?
Yeah, so since as we mentioned earlier, we just started using this.
Yeah.
So we don't have that many examples yet, but really looking forward to getting more examples. And also by having this tool, we'll then naturally get a focus on this. That will be focusing on asking for this data.
So for the example you used or you presented, I don't remember if or recall if it said what was the kind of assumptions about fuel consumption in that Alhul example?
I believe it was around 6,000 liters.
And that's
25,000. No, 6,000. Nope, I have a very small printout there. I think it's 25,000 liter.
Okay, and
Yeah.
that's for like 4-month period or?
Yeah, 4 to 6 month period.
Okay, interesting. Yeah. I'm sure I can supply a little bit when I'm done with the project on where the fuel consumption is based on the numbers, but yeah, it's good to have some experience as well.
Looking forward to that.
Great.
We did look a bit into the emission factor or the sensitivity of the emission factor though. And first we used the Norwegian one where we have some biofuels included, right, from the environmental agency. And then we changed it to the official one that Maria said through the other projects, the Red Cross projects. And we saw that changing from, I think it was 2.6 kilogram CO2 per liter to about 3.5. It didn't really change the share of fuel consumption that much.
Right.
So it's not that sensitive. Yeah.
Well, thank you. Currently, I don't have any more hands up, so I encourage those that are sitting with a question deep inside them to actually bring them out, because in 10 minutes time, you will not have that chance.
There's a question in the chat.
In the chat? Oh,
yes.
I have to jump. Okay, back. Sorry, there's a question in the chat. So there is a question. That's one. Okay. This is my. Sorry, I have to see if I can blow this up a bit. Thank you. There we go. What measures, excluding moving the warehouses, do you think are the easiest to take or are most realistic being implemented in the future?
Which reduction measures? Yeah. So then I would think, for example, this the diesel for the generator is one that we have control over, and this is something that we can look into.
Thank you. Let's see, there is actually a hand up, so please ask your question.
Hi, I was wondering if I could come with a follow-up question, because you said the next thing would be maybe the diesel generators at the field hospitals. Would the next option to try to mitigate some of the greenhouse gas emissions be to use solar instead?
That could potentially be an option. Yeah, we're looking into that.
Okay, and have do you have any knowledge of any field hospitals that have already used solar systems? Because there would be some problems, I assume, with like the reliability, considering the weather and how many days of autonomy you need for a hospital.
So not example for emergency hospital, but we have within the movement, we have used some different kind of equipments for health clinics, health situations in the same countries. So.
Okay.
But you're right, when you're sending out a hospital, everything has to be able to be put up and has to work immediately, and yeah.
Okay, thank you.
Thank you. Let's see. I'm just going to see if there's any more questions in the chat. Yeah. Ritva, you had another question. You want to ask that yourself, maybe? Or I can just go ahead and say, let's see. Is that the question? Yes, we are looking into it, but the return of, that's an answer actually. That was why. So yeah.
Yeah, if you want, I can explain.
Yeah, please do.
I just had a meeting with a company who turns local rural hospitals into solar-powered hospitals, but they say that the normal payback time or return of investment is 5 to 6 years. So in that sense, if you only think about money, it's not really feasible for a 4-month or 6-month hospital. And anyway, there are a lot of technical challenges with that as well, but we are looking into actually maybe doing parts of the hospital as solar, but we will never get rid of the diesel generator as a whole. It will always have to have at least one as a backup. The company is called Build Health International. It's a US-based company.
Yeah, you're right. It will probably be a hybrid solution that if we'll be able to do something. And that's very interesting.
Thank you. And there is a question from Francisco. Please.
Yeah. Hi. Very interesting. Thank you very much. I just want to make a side comment on these estimations because we need to realize and accept that the more we want to streamline or to reduce emissions, it reduces our ability with regards to flexibility. If I could compare this with the question, with the approach to reduce the emissions that are calculated with the fact of moving the hospital to Africa, to Nigeria, I think Marie mentioned that the store. There was or there is a project here in Norway that resulted on where along the Norwegian coastline should be put the emergency sets for acting upon an oil spill on one of the platforms. So the more sets, the easier will be to contain an oil spill, the fastest and the less damage and so on, because it's just by distance, it will be nearest. But we cannot cover the whole coastline with sets for this one, right? So there is a balance there. So the more efficient one is, the less flexibility we'll have. So it has a cost benefit in each one of these. And one has to accept that, okay, a criteria has to be defined. We can discuss, or one can discuss how to set the criteria, but it has to be some point of balance that we're going to have to live with this in order to have the flexibility. So, because if we eliminate all the flexibility in order to make it as optimized as possible, then it becomes too rigid for the purpose of having an emergency response. It was just the comment I wanted to make in there, that we have to, it has to be accepted that some flexibility will imply some emission reductions. Okay, and in this case of the diesel generator and the solar panels, it's an example. I mean that okay, yes, it has to be some backup, because also it cannot be some of the services cannot be dependent only on the solar panel or on the reliability that the solar panel offers. So it has to be some emergency there, and that will imply something extra that many times will not be used, but it has to be there for as an insurance for the moment that the other one, the original equipment doesn't work. So it has always to be some balance in there. It was just a side comment.
Thank you. So any comments, questions from now? Well, in that case, since nobody has raised their hands or in the chat, let's see quickly. Nope. So then I would like to close this session by thanking both Ingrid and Maria for the effort, and everybody present here for joining us to this digital assignment report, and hope you will join us for the next. So, and that will be around, I think it was 9 of February. So please, hope to see you again. Thank you, everybody. A big applause for Maria and Ingrid. Thank you.
Thank you.
Bye. Thanks for showing up, everyone.